Welcome to case-based learning of cardiac MRI on mricardiac.com. 35-year-old male underwent routine 2D echocardiography for preoperative assessment. It revealed mass lesion attached to right ventricular wall. Cardiac MRI was performed for further workup. These are Cine SSFP 4-chamber images of the heart. It reveals a well-marginated smooth lesion attached to free wall of right ventricle. And as you see over here, the signal intensity of the lesion is similar to adjoining muscle. Short axis CineStack images, it confirms presence of mass lesion, which is attached to the free wall as well as the diaphragmatic surface of right ventricle. It is limited to cardiac chamber and there is no extra cardiac extension as seen. First pass perfusion images are obtained to assess the vascularity. And as you see over here, the lesion remains persistently hypointense, which means that there is no increased vascularity. However, late gadolinium enhancement images, which are obtained after delay of 10 minutes, it reveals that there is heterogeneous post-contrast enhancement of the lesion, as you see over here. So there was no uptake on first pass perfusion, but delayed enhancement on LGE images. And these features are suggestive of fibroma. Now let us learn something about approach to cardiac mass on cardiac MRI. Cardiac MRI can tell us about the location and anatomic relationship of the mass. You have to talk about margins, whether they are smooth, irregular, or infiltrating. Mobility, for example, whether the mass is mobile, what is its relationship on related to mitral valve, tricuspid valve, and what is its significance? And this can be seen on cine images. Signal intensity, like morphology, can be assessed on T1 and T2 weighted images. Vascularity is assessed on first pass perfusion, while enhancement characteristics are assessed on the late gadolinium enhancement images. You may also have to look for tumor-associated complications like pleural or pericardial effusion and extracardiac extension of the nodule, mass lesion. Features which are suggestive of malignancy include large size, that is more than 5 centimeter, irregular, ill-defined borders with infiltration, lesions directly invading through the tissue planes also will be malignant. Multiple lesions can be seen in metastasis, hemorrhagic pleural or pericardial effusion. All these are features suggestive of malignant disease process. Let us go through a few differentiating features, characteristic features of various cardiac masses. For example, between myxoma and thrombus. Myxoma will remain hyper-intense on muscle, while thrombus will be iso-intense on muscle. Thrombus will not show any contrast uptake. It will remain dark even with long TI time, and you may see some myocardial scar along with it. However, myxoma will be an intracavitary lesion which can be mobile, and it will show heterogeneous post-contrast enhancement on LG images. Sometimes you may get pedunculated stalk with it. The commonest sites are in the atria, left atrium and right atrium as seen over here. Mobile lesions attached to valve. Again, the differentials can be whether papillary fibroelastoma or vegetations. Papillary fibroelastoma will be hypointense to muscle and it may show enhancement on this, while vegetations will never show any contrast enhancement. And most importantly, they are so small and located along the endocardial surface, and they will be signal intensity will be similar to muscle. Clinical presentation of infective endocarditis with valvular dysfunction emboli again will point towards vegetations. In case if you get a mass which is hypervascular, think of hemangioma because that would be hypervascular on perfusion and it will show slow uptake. Paraganglioma, a neural tumor, again will be hypervascular on perfusion, but it will show intense post-contrast enhancement like light bulb appearance. Few metastatic lesions, especially from carcinoid, can also show hypervascularity. Intramuscular mass in children, differential will be rhabdomyoma or fibroma. Both of them will be looking like muscle, but rhabdomyoma, which we see in cases of tuberous sclerosis, will null like normal myocardium, while fibroma, as we saw in this case, will be relatively bright on LG images. So these features can help us to characterize different cardiac masses. Similar concepts can be found on Cardiac MRI Simplified book. In case you have any feedback or suggestions regarding the cases, please mail us on info@mricardiac.com. Thank you.